go ahead and provide privacy and perform hand hygiene. I'm Caroline. I'm going to be your student nurse today, and I'm going to be performing your wound care for you. If you could tell me your name and date of birth while checking on your armband. Okay, perfect. I'm going to go ahead and check the physician's record over here to make sure we're going to be doing the right wound care for you, and that looks right. How are you feeling today? Are you feeling okay? I know we gave you the medication about 30 minutes ago, your pain meds, and to help prevent the medication, so I'm glad you're feeling better. But today what I'm going to be doing is changing your dressing from your wound, and what I'm going to be doing is taking off the old dressing and cleaning it for you and putting on new dressing so we can prevent infection and make sure it's healing okay. So that's what we're going to be doing. So do you have any questions about that? Okay, and I'm going to go ahead and get my sterile field and everything set up over here. And when I get all the supplies out, just make sure not to touch it, and make sure not to touch your wound or anything. We want to just keep it as clean as possible. So I'm going to go over here, and I'm going to get my clean gloves. So I've already performed hand hygiene. I'm going to get things set up for you so I don't have to uncover you yet. Okay, I'm going to lay this bag right here by your leg so we can put all the dirty stuff in here when I'm removing stuff. I'm going to lay that there. Okay, I'm going to move this over. I'm going to start to set up my sterile field here. Pull this out, and only touch the edges. Okay, I'm going to move this over. I'm going to go ahead and pour my solution in here so we can clean it for you. And I'm going to pour 2 different containers, one for actually cleaning and one for when I pack it. So I'm going to go ahead and set up this. Okay, now I think we're ready to go ahead and start. So I'm going to pull the sheet back here, and I'm going to start to remove your dressing. If you have any questions or if you feel any pain, just let me know. So I'm going to pull up the tape here towards the wound. I'm going to go ahead and look at it and make sure everything's okay. It's looking good. There's no odor or anything. Just hold that. Pull this out. Just going to go ahead and unpack your dressing here. Put all this in here. At this point, I would have to take off my gloves and perform hand hygiene again. And I'm going to go ahead and put on new gloves. And we're going to get started on cleaning the wound. But first I'm going to assess the wound, and I'm going to use one of my Q-tips, but I would actually have a Q-tips that would not be in my sterile field, so that I wouldn't have to reach into my sterile field at this point, since I don't have on sterile gloves. But for this purpose, I'm just going to go ahead and measure it. So I'm going to go ahead and measure the length here, and I'm not actually touching the wound, so we can continue to use this. And it looks to be about 5.5 centimeters. And we'll go ahead and do the width, which looks to be about 6 centimeters. I'm going to do the depth. Now it looks to be about 3 centimeters. And we could actually take this and measure the circumference, which looks to be about 6 centimeters. So I would discard of this. And now at this point, I can still, we're going to clean the wound, but I'm going to reach into my sterile field and only get the gauze. And we're going to begin to clean the wound for you. Now this might cause some discomfort, so just let me know, just hang in there. Now I'm going to go ahead and clean the base of the wound right here in the inside. Throw that away. Get another gauze pad here. And I'm going to clean right underneath the skin around here. And at this point, I would still have another sterile pack of Q-tips that wouldn't be in my sterile field over here, so I wouldn't be reaching in my sterile field like this. But at this point, I'm going to go ahead and get my Q-tip to clean out my tunnels here. And while I'm cleaning out the tunnels, I could actually measure too while I'm doing this. So my measurement for my tunnels would be about 4 centimeters. And I would still have more Q-tip, so I wouldn't reuse this Q-tip at all to clean out the next tunnel. So I could clean out my other tunnel over here and measure it also, which this one looks to be about 3 centimeters also. So this would not, I don't have any more Q-tips over here, but I would have other Q-tips that wouldn't have been in the sterile field. So I'm going to leave this over here for now, just for today's purposes, but it would not be part of my sterile field. So I've cleaned that part, the tunnels, and now I'm going to clean the outside of the wound. And I'm going to dip this in here. I'm going to clean this side over here. Other side. Okay. And it looks like your wound is healing pretty well. There's not much redness or swelling. So, and when I palpate over here, it doesn't feel bad. So it looks good, and it looks like you don't have infection or anything. I'm going to go ahead and dry the wound off. Dry the outside over here. Okay. And now I'm going to go ahead and start my sterile technique. So I'm going to remove my gloves. And I'm going to move this over. I'm going to move this over here so I'll have more room. Move this over here too. Okay, and first I'm going to go ahead and wash my hands though before I touch my sterile field. So I'm going to grab my gloves over here and go ahead and open them up. I'm not going to touch the outside of the glove. I'm touching the cuff here. That will be part of the inside. They're kind of difficult to get on here. I'm still only touching the inside of the glove. And then over here, I'm underneath the cuff. Make sure not to touch the outside of the gloves here. So go ahead and move this away. And now I'm going to go ahead and begin packing your gloves, or not your gloves, your wound. So I'm going to take this, and we're going to be doing wet to dry today. So I'm going to go ahead and get my gauze over here. And I'm going to be actually not be using the first one. I'm going to be using my second solution over here. I'm going to wring this out. I'm going to wrap it around my finger like this. And this would be a sterile Q-tip, as I said before. But I'm going to go ahead and start packing the wound. I'm going to start with the tunnels first. And we could actually touch the gauze because it's sterile. Now actually I need another piece of gauze, which I would still have more Q-tips at this point, but for now we only have this one. So I go ahead and wring this out and wrap it again. And go ahead and pack the rest of the wet gauze in here. Okay. Are you still doing okay? Okay, we're almost done. Okay, and this point we can throw that away. Now I'm going to get my dry gauze, and we're going to put a piece on top like this. And now we're actually going to get this piece, and you can actually cut this if it's too big. So I'm just going to kind of make it to the size of the wound here. And then at this point, the wound is sterile, so I can remove my gloves. And we can go ahead and tape you up here. So I'm going to get my tape. And I'll want to go ahead and tape all 4 sides. Might need a little. Okay, and what I would do next is I would go ahead and write my name or put my initials and put the date and time this wound was changed so we know for further reference. And I'm going to go ahead and cover up your wound here for you and discard of all my trash over here. And I would throw all of this away because it's not sterile anymore. So are you feeling okay? And can you rate your pain for me on the pain scale? Okay, good. I'm glad you're not having any pain. Well, I'm going to record everything I did today and the dimensions and everything of your wound. And if you have any more questions or if you're in pain or anything, just call us and let us know. Thank you.